Before you move to a new place or a new country, there's a question that plagues the mind of almost everybody. Can you guess what that question is? The question is, what is the healthcare system like over there? And that's one question I often get. Precious, what is the healthcare system like over here in Dominica? And guys, guess what? I have exciting news for you. But just before then, welcome back to the YouTube channel. My name is Precious Ayorinde. I film videos on faith, relationship, and lifestyle all the way from, you say, the Commonwealth of Dominica. So, back to the good news. Today, I'm going to be giving you a sneak peek into the healthcare system here in Dominica. We're going to be visiting the office of a gastroenterologist. So come with me as we find out everything that's on your mind about the healthcare system relating to gastroenterology. Come along. So guys, right here in the heart of Roseville, I cite a gastro clinic. So let's find out what this gastro clinic is all about. Hi,
welcome.
Hi, my name is Precious.
Okay, welcome to Gastro Clinic.
Thank you.
Okay,
what's your name?
Megan.
Oh,
so you can have a seat. How may I help you today?
I was just passing by and I saw that there's a gastro clinic here, right? So I want to have an idea what this place is about. Why should I come here?
This is owned by Dr. Antonio Sanchez as well as Dr. Yaritza Lopez. They are both gastroenterologists, specialized in the digestive system. So if you're experiencing problem with your stomach, you're having stomach pains, right? You're having indigestions, you're having diarrhea and stuff like that, you can visit Dr. Sanchez to get further treatment.
Do I need a referral to come here?
No, you don't necessarily need a referral. You can just do a walk-in based on the symptoms you're having if it's a digestive issue.
What time do you guys operate?
Normally open from Mondays to Friday, and sometimes based on the situation, if it's an urgent situation, then he can do a procedure on Saturday to accommodate the patient.
So Mondays to Fridays, what time?
From 7:30 to 3 p.m.
Once I come in, I get appointment?
Okay. Yes. Would you like to make an appointment?
No, I just came for inquiry.
Oh.
I just came to find out about this place, right? And to let people know what goes on in this place. People want to come to Dominica and they want to know what the healthcare system is like in Dominica. Health is wealth. Like, you have to take care of your health, so you want to know if the place is good.
Dr. Sanchez is the best. And for sure, you can get that feedback from Dominicans. I mean, he's the best, and there's no doubt about that. There is no way you can go back without a treatment or without a solution to your problem.
Oh, so I can come for consultation, I can come for treatment. Like, what treatment? What do you do? Do you do any procedure in particular?
Yes, so we do endoscopy, colonoscopies, rectosigmoidoscopies, and if necessary, endoscopic polypectomy. That's a type of surgery.
So if I'm coming for consultation, right, what should I come along with? What should I bear in mind before coming?
So you can just come in and the doctor will explain you whatever you need to do based on your symptoms that you're having. Then he will advise you whether you will need to do an endoscopy or colonoscopy, and we'll give you further details on that.
There's a consultation fee that I might have to pay and all.
Yeah.
Is the doctor nice?
Well, he's very nice, very gentle, and he takes his time. He's very detailed, so he takes his time to explain step by step and ensure that you understand your situation as well.
Oh, that's nice. Do you offer virtual consultation?
Yes, we do.
Virtual consultation? Oh, really?
Yes, we do.
How does that work?
The patients will actually let us know if they are willing to do that, and then they pay via mobile banking.
Okay, so then you talk to them on the phone?
Yes. So we do video calls.
Anybody anywhere in the world can do this virtual consultation, or you have to be in Dominica?
Anybody anywhere in the world can do this virtual consultation.
Oh, do you accept insurance?
Yes, we do.
If there's an emergency, can I quickly come here?
Well, no. So we don't accept this kind of emergencies because with every test there is a preparation. So you must do a preparation if you have to do any of these type of tests. So emergency, we recommend you go to the hospital. And then if according to what it is, they can refer it back to Dr. Sanchez.
So, Megan, it's been so lovely talking to you. But tell me something. Why should anyone choose to come here?
Because Dr. Sanchez is the best and you can never regret. And also, he has over 20 years experience in this type of, service. So there is no way and there is no doubt that you're going to be satisfied with this kind of service.
Wow. Can I see the doctor now? Let me see this Dr. Sanchez for myself.
Yes, for sure.
Yes.
Good afternoon, Doc.
Oh, hello.
Hi. Good afternoon.
Oh, hello. Good afternoon. Welcome.
Well, thank you. My name is Precious Irende. Your secretary told me that you are the best in the field.
Oh, please.
So it's an honor.
I'm just one of them.
May I have my seat?
Of course, please. Have a seat.
Thank you. Hi, Dr. Sanchez. It's a pleasure meeting you once again.
The pleasure is mine.
The best in the field, right?
Oh, it is. Just one of them.
Oh, okay. So are you Dominican? Because I'm not sure you are Dominican.
Oh, no. I'm originally from Cuba. I came in 2015, so it's going to be 10 years in Dominica now.
Oh, wow. So you're a Dominican already?
Yes, the time flies.
So I was told by your secretary that you do some procedures here, like endoscopy, colonoscopy.
Oh, yes. We do upper endoscopy, open and lower endoscopy. So what we call gastroscopy is the term that usually people know this test about, and the colonoscopy, which is the lower endoscopy, GI endoscopy.
So who should do this test?
Right. So endoscopy is a test done with a long flexible tube with a camera in the top and a light inside that should be placed through the mouth all the way in up to the stomach and the small intestine. It's a procedure that is done to try to find out the cause of the discomfort and the pain or the clinical situation that the patient is presenting. This is an invasive procedure, even though it's kind of fast to be done. It's an invasive procedure and should not be the first step to go ahead with in any situation. There are clinical indication, medical indication to go ahead with endoscopy. So if the patient presents one, two, or three of them, so it's time to do it, right? There are what we call in medicine alarming signs. For example, if the patient have an intense abdominal pain in epigastrium that the doctors have been trying different alternatives and the pain is not subsiding. If the patient is having discomfort that goes and comes and is not going away, whatever it be the treatment or the options that all the doctors have been putting in practice before, and the patient is just there, not disappearing, because it might be a little ulcer, for example, right? That can cause this. And the best way to determine to the diagnosis is doing an endoscopy. There are so many conditions inside the stomach, the esophagus, and the small intestine that can put the patient suffering. And the best way to detect them is running the cameras through the mouth to see what is the problem going on deep in the digestive system.
Wow. This is really informative, Doc. So, people have ulcers a lot, and they just get medications. Should they do the endoscopy to know how to treat themselves, or should they just go to any doctor or go to the hospital and just get medication?
Well, let me put this clear, Let me put this straight. There is something that is known already from years and years, which is the clinical method, right? The first thing to do is an interrogation of the patient, and then a physical examination, the diagnostic test, and finally the treatment. If you, from the way you feel now, jump straight to the treatment and try this and that and all kind of options without knowing exactly what is going on, this is going to be something experimental, empiric, that can bring the patient certain consequences, right? So it's better to, if you feel some symptoms that you're not understanding quite well, it's better, and they are related to the digestive system, so it's better to go ahead and do certain investigation, and this one is one of them, to try to find out the diagnosis first, treatment after.
So, Doc, can you talk about this colonoscopy that we all hear about? What is it for?
Right. Colonoscopy is another test with the endoscopy, the kind of endoscopy, because it's done with cameras inserted in a long flexible tube, again, with lights and different system of cameras and lens that should be placed, this one through the rectum, going inside the large intestine, which is the colon, trying to detect whatever is happening there. There are multiple conditions inside the colon that can be detected thanks to colonoscopy, right? I know that the most frightening is the colon cancer because everybody talk about colon cancer, right? But there are other conditions, a lot of them, that can be diagnosed properly through the colonoscopy: diverticulosis, inflammatory bowel disease, malformation, angioectasias. I mean, there are so many conditions inside the colon that can be detected thanks to the colonoscopy, right? That made this tool of diagnosis extremely helpful. But of course, the main part of the plate is the colon cancer, which is something that has to be actively screened for, starting now from 45.
Wow.
Yeah, at 45 years old, men and women should do the first colonoscopy due to the high incidence and prevalence of colon cancer in people under 50.
Wow. Are there people that are more predisposed to having this colon cancer?
Well, there are what we call the risk factors, right? One of them is the age. Right? I mean, the colon cancer increase, the risk of colon cancer increase based on the age, right? The second one is the antecedent of polyps, which is the little growth in the wall of the colon that can be transformed over time in cancers, following the sequence polyp cancer, right? There are other conditions, for example, inflammatory bowel disease, family antecedents of colon cancer, certain conditions inside the inherited conditions. For example, the familial adenomatosis of the colon that can be predispose certain individuals to develop a colon cancer, right? The diet, the way we eat is another risk factor for colon cancer. Unfortunately, not everybody follow the healthy diet. You know, we are surrounded by all these kind of temptations in terms of diet, you know, fast food. Everybody's living nowadays in a rush, trying to make their days worth it at the end of the day, right? But that exposes you, if you're not eating well, to develop certain conditions, and colon cancer is one of them, that unfortunately has one modality of presentation of colon cancer, which is the asymptomatic, so no symptoms and signs.
Wow. Many
people usually ask me, and it has been said in so many books and papers and reviews, what is one of the most important or the most frightening symptom and sign of colon cancer? The answer of that is no symptoms and no signs. So you can have colon cancer without letting you not knowing, you know, don't feel absolutely nothing that allow you to know you're having it.
Wow. So Doc, I want to ask, if people have parents who have passed from colon cancer, are they at risk for colon cancer even if they eat healthy and do all these things that meant to do?
Unfortunately, yes. The answer for that question is yes, because it's an inheritable cancer, and actually one of the risk factors that people might have to present to develop a colon cancer is precisely being a first-degree relative of a patient with colon cancer. And those specific patients, I mean first-degree relative of a patient already diagnosed with colon cancer, the screening should start even 10 years earlier.
Wow.
So I'm talking now that, for example, if the screening colonoscopy for colon cancer used to be done before at 50 years old in those children coming from patients with colon cancer, the screening now should be done at 40. Right now, based on the American Society of Cancer and institution leader in this investigation all over the world, now it has been agreed by international experts that the starting time to do colonoscopy should be 45 years. So, but for those coming from related somehow, specifically first degree relative of patients with colon cancer, the screening has to be starting now between 35 to 40. Yeah. So at that time, it will be interesting to go ahead with the first colonoscopy, at least to be sure everything is okay. I would like to highlight that the importance of a colonoscopy as well is not only to make diagnosis if there is a colon cancer or not, also to detect on time small lesions that can even be removed through the same colonoscopy, so you don't need to you need to go ahead with an operation, a major surgery to remove none of them, right? Yeah. So I was talking about before the importance to detect on time polyp. The polyp can be minimal growth, sometimes can even so minute that less than a centimeter, and it can be easily removed from the colon just doing this test on time, right? Of course, if we reach the point that the polyp detected is a huge mass, not malignant, nothing like that, but it can be still there is a possibility to be removed endoscopically with a test done, and what is called endoscopic polypectomy. So then the colonoscopy is what I'm going to try to highlight. It's a test that can allow you to not only know, also take actions the same time of the procedures is going on. So it's a very, very, very useful tool in terms of diagnosis and treatment at the same time.
Wow. So doc, let me ask, are these procedures painful?
Well, as I said before, endoscopy is a kind of fast procedure. It can be done between 5 to 10 minutes, and the patient can be awake or sleeping. It's optional. So the procedure is not painful at all. But it's very uncomfortable. So that's why, especially for those with difficulty to breathe, for example, with antecedent of sinus, that might have the sensation that they cannot breathe, but they are actually breathe because my entrance is different from the respiratory tract. We are going to be in the digestive system, not in the respiratory tract. So the most important part is, and it's a good question, that it's a good thing that you're asking me if it is painful or not, because all these tests needs, before anything else, a mental and psychological preparation, right? So it's something that have to be, of course, agreed during the first interview, when the patient have to be provided all the information in terms of how long it's going to take, if there is any risk involved. I mean, when they are able in the first interview with the patient to clarify all their fears and all their concerns about the test, usually that happen in 5-10 minutes, effortless. Yeah, but for those that again have certain particular predisposition and they think that might not be able to be at the point of tolerate this awake, there is always an option to put them to sleep. Colonoscopy, when it is done with the right technique, it can be done easily awake. We have been done colonoscopies in multiple times here. Patients that just by decision, they don't want to be exposed to any anesthesia. They want to actively participate in the diagnosis. So we could go ahead with a colonoscopy, and except for little discomfort, we were able to reach the cecum, which was the last part of the colon, without any particular excruciating pain, nothing like that. But I have to make myself clear at the same time. There are certain patients with certain modalities of colon, especially those after surgeries, after different interventions in the abdomen. The disposition, the colon, the way that the colon is placed inside the abdominal cavity might be different compared to everybody else. So in those cases, particularly, the intubation of the colon, the cannulation of the colon might be a little bit difficult, and it can cause pain. So in those cases, it's better to put them to sleep. The option for sedation is always there, it's always available.
Okay, so are there any risk while doing it? As
you can imagine, colonoscopies, endoscopies, they are unforeign bodies, right? Going inside the human being, trying to find out whatever it is inside, right? So there is always a minimal risk of certain complications, let's say, but there are so minimal that for when you do this kind of test, endoscopic and colonoscopy, for diagnostic purposes, they almost never happen.
So doc, some people are scared of anesthesia, because of Michael Jackson.
Oh yes, it's true. Because of Propofol and Michael Jackson. Yes, I understand the feeling. But the thing is that Propofol has been universally used, and it's very useful for sedation in endoscopy field. Yeah, because it's very easy to induce the patient on sedation and bring him up. If we really want to wake up the patient quickly. I mean, the time lapse is extremely short, so that is the reason for it. It's easy to reverse the effect.
Oh.
So when it comes to wake the patient up right now, it's easy to get him or her rid of the effect of the anesthesia, totally effortless, without further consequences.
People always say the preparation is so bad, it takes days, they don't eat. Is it that bad?
Oh no, preparation now is easier than ever before. Yeah. So the summarizing the preparation can be, usually start almost a week before. The patient have to stop eating fruits and veggies. No high fiber diets for just a couple of days, 3-4 days. And then after that, the patient have to, the day before the test, the patient have to follow certain instructions in terms of taking laxative to help themselves to clear the colon. Yeah, it's a combination of tablets and powder. The one useful nowadays more is the polyethylene glycol that come in different preparations. So thanks to the polyethylene glycol, we can 24 hours now we can get rid of any residuals, any stools in the colon that can prevent the endoscopies to see properly with clarity enough all the lesions inside the colon. So preparation is now easier than before.
What about the endoscopy preparation?
Yeah. No, the endoscopy is even easier than the one for colon because endoscopy is just too fasting from the night before. Usually the night before, by dinner time, the patient have to take a very light diet, maybe some cereal, little soup. After that, juices or water until 11 o'clock, midnight. After midnight, nothing to eat, nothing to drink. The patient have to come to the endoscopy with an 8 hours fasting, right? Empty stomach.
Thank you, Doc. So, Dr. Sanchez, how long does this procedure take? You already mentioned that the upper GI endoscopy takes like 5 to 10 minutes. What about the colonoscopy?
Colonoscopy is about a half an hour to be done. It depends again in the particularities of the patient, right? Not all the colons are the same. Patients have different antecedents. There are those with antecedent of operation, surgery, something that changed drastically the anatomy of the abdomen. So according to how the colon placed inside the abdomen after the surgery, that will be easier or not to go ahead with the colonoscopy. In those cases, for example, with hysterectomy, C-sections, these kind of operations before, the instrumentation might take maybe 35-40 minutes for 0. Yeah, but it's usually around that time.
So will I need someone to drive me back home if I do a colonoscopy or endoscopy? Or is it based on if I do it awake or asleep?
Well, remember that if you are going to do one of these tests, sleeping, under sedation, it's safer that you ask somebody to drive you home for you to reach home safely. Because remember, you're going to be only the effect of the medication even if the test finished, and then your reflex will be a little bit low in terms of driving, will not be too safe. So it's better to drive you back home by somebody of your trust.
When these procedures are done, how soon will someone get the results?
Oh, right the day after.
Oh, wow.
No waiting time at all. In 24 hours, you should have all the results in your hands, at least the next step to take. Remember that after we find whatever we find inside the colon, there is a strategy that activates automatically, and then that strategy included not only the reports and the possible diet recommendation and prescription, also for those patients, for example, that after this endoscopy or colonoscopy might need a surgery, so automatically all this process activates. It's kind of a trigger.
So can they find some of the medications they need for the island? We know Dominica is not such a big place, but we're also trying to give people an idea of the healthcare, how it works in Dominica. So will they find most of these medications on the island?
Oh yes, you have in the island pharmacies, with resources enough to at least to cover the basic needs, the most frequent diagnosis we have. So yes, we do have medications available for the most frequent conditions detected by all these tests. Of course, like in everywhere, there are always exceptions, right? But always the pharmacy are able to help, even if it is necessary to be ordered overseas, they can do that action for you. So it's something that can be arranged.
Okay. And I also heard, that you offer virtual consultation.
Yes, we do. Yeah, we do, because we are in this constantly moving world, and sometimes people are here overseas, and I'm always willing to help somehow.
So you work with a doctor overseas, or how does that work?
Yeah, even myself, I'm moving now because part of my family is living overseas. So when I'm not in Dominica presently, physically speaking, I will try to make myself available just in case the patient need me. So the virtual, WhatsApp is always there, the video call, and thanks to technology now, the spaces are not longer a limitation. So even though I'm not too fan of the virtual consultation, because I know I trust too much about the importance of the face-to-face contact, and to feel the patient's karma. So I'm more on the physical examination, something that you cannot do through a screen, right? Yeah. But in case if it is necessary to be done, okay, well, I'm willing to do it.
Doc, let me ask this big question. Can a colonoscopy truly prevent cancer?
Oh yes, definitely. Colonoscopy is an active screening tool that we have in the medical practice that can detect on time small lesions that can become into a cancer if you leave it abandoned, if you are not aware through this test that they are there, that they exist. So yes, in terms of screening, still continue to be the number one in terms of screening tools available to detect and prevent colon cancer.
So Dr. Sanchez, it's been so lovely having you answer these questions that I believe a lot of people would want to know about. So let me ask you, why should we come to you in particular?
Well, that's an interesting question. I think that experience in life has value. So I've been working in gastroenterology for almost 20 years now, dealing with the stomach and intestine of so many people, so many problems and conditions, apart from cancer, right? That can affect the digestive system, but also my origins. I'm coming from the National Institute of Gastroenterology in Havana, Cuba, and the possibility that I had in that institution to finish my training, to complete my training as an endoscopist, as a gastroenterologist, that made me the professional of the size that I'm having now, right? So I think that the possibility also to get in contact with other realities that in so many places, even inside Cuba, they'll give me the tools and the knowledge that I'm offering now to all my patients coming to requesting gastrointestinal services, right? Medical attention in gastrointestinal field.
Wow. Doc, I heard you once went to Africa.
Oh yes, that's another part of this story of these 20 years. I've been in Africa. I went to Angola in 2012. At that time, Angola was also struggling with the possibility to get Ebola outbreak from Congo Democratic. It was a hard time at that time. But I had the chance also to get in contact with other realities, other diseases that I was not familiar with. For example, intestinal tuberculosis and malaria, all kind of diseases that I know about from the tropical chapter in gastrointestinal books, but never had the chance to see them in real life. And I had that chance, I had the possibility, apart from making such a lot of friends in Africa, in Angola, I had the chance to be exposed to that knowledge, and I took it from me when I went back to Cuba.
I heard that I can also bring my child to you. Is that true?
Yes, it's true, because the digestive system is quite similar in pediatrics than in adulthood.
So Doc, thank you so much. It was really nice having you, talking to you about all these procedures, why should they be done and all. I really want to say that we appreciate you. Thank you so much, Doc. It was nice having you.
It's my pleasure to have you. Anytime, please. Anytime.
Thank you. And just in case you're wondering where this place is located, it's located on number 53 Hillsborough Street, right opposite to the Hillsborough Medical Center here in Roseville, Dominica. And the number to contact is 614-1668. That brings us to the end of today's video. I hope you enjoyed watching, and I hope we're able to address most of the questions that might have been plaguing your mind regarding endoscopy, colonoscopy, and I hope you take to heart the advice given by Dr. Sanchez. Till I come your way again, I still remain Precious Ayerinde, and from me to you, it is bye.